This tea is still hot.
All righty, folks. How is everybody today?
Hi, everyone. Welcome.
If you can hear us, say yes, please. Well, don't say yes, please. Say yes, please, and thank you. Well, I guess nobody can hear us.
Oh, not again.
Yes, we can hear you. Thank you, Kevin and Mary. All right. Hope you're all doing fine today. Any Californians from the Quake region, you a little shook up today? Big 7.0 there today.
Was it?
Yes.
I've missed that news.
Yeah, early this afternoon, our time. Okay. So we are here tonight to talk about healthcare, starting in about 2 minutes. We are, let's make sure we've got a stream going, several different Facebook groups on YouTube. Welcome to everybody there. You folks on Facebook and YouTube can ask your questions by just making a comment, and the comments will be shown here so we can answer them. We're not quite at the question Q&A point yet, but first of all, yes, please. The rest of you, only a few of you have entered your names and where you're from. Let's see where you're all from. It kind of gives us an idea how to answer and how to stress the questions. We got Texans, and Virginia. Oh my goodness. You guys should all get together, your Texans, and have a little party. Hey, Ruth and Harvey. Hey, Steve. Ellen and Mark from Give Back. Margaret. It's time is coming soon, Margaret. Hey, Joyce, how are you? Nancy, Jesse, Bree Whitmore. Good to see you. Ellen, Dan, Mr. Roop, how are you? Boquete, I thought you lived in Palmyra. Did you move? Huh.
Who's that?
The Roops. They just said they're from Boquete.
Oh, yeah. Up in Palmyra.
Laura, how are you? Ilba and Roy. I cut in and out. Does anyone else hear me cutting in and out right now? We're just doing a sound check. Oh, look at all those people that said yes. I got a bunch of no's on that. A whole bunch of no's. So hopefully your connection gets a little bit better there, folks. All right, we're going to get started pretty soon, guys, here. Is it 7 o'clock? We wait till 7:01 because we're Latino time.
Just sending a quick message to our tour group.
Oh, okay.
We have a tour group arriving today. So
yes.
They're just our last ones are coming in right now, and just wanted to give them a welcome.
That's why there's no Oscar sitting beside Megan.
Yeah.
And he is in Panama City with the group ready to go tomorrow morning. Perfect. So we're going to have a 3-phase evening tonight. So sit back for the next 3 or 4 hours. Enjoy yourself. Kidding, 1 hour or less.
Ali.
We gotta look. We can see Ali, who is we're interviewing tonight at the bottom of our screen there. You guys can't see her yet. When I said 3 or 4 hours, I got a dirty look. But anyways,
1 hour,
yeah.
But packed full of good information for you.
I'm going to give you the scoop of after being a North American and seeing both in 13 years, the public system and the private system. I'm going to give you guys an overview of the healthcare system in Panama. Then we're going to bring on Ali, who Megan's going to interview, and we're going to talk and really drill into your insurance options, because after you listen to me, you're probably going to want some type of good private health insurance here. And then we're going to have an open Q&A to get all your questions answered. First of all, we have a lot of people here that I don't recognize their names. So Megan, we actually have to tell them who they are. So first, briefly, Megan, in 1 minute or less, who our company is and then who you are.
Sure. So we are Retire in Panama Tours and also Panama Expat Service. So we offer a lot of tours, 7-day tours, 3-day tours, cross country, and then also in the Cherokee Highlands, group tours as well as private tours, and a lot of a la carte services for people who already know where they're moving or already maybe moved here and just need help getting some certain things done or set up. I am Megan. I'm from Pennsylvania. I'm the operations director, so I handle a lot of the operations and logistics. If you come on tour with us, you'll get a lot of preparation emails from me. And of course, I always love to meet our groups and our tour guests when they make it to Boquete area, which is where all of our team lives. And yeah, that we love to do this. We're all expats here in Boquete, but we bring a different perspective. I'm from the US, Rob's from Canada, my husband Oscar is from Colombia, and we've all had to go through the transition that expats go through, moving to a new country, learning a new culture, getting a new life set up here, and just going to be your new home. So we love to help you guys do that in a really smooth and enjoyable way.
Okay. My name is Rod Larrabee. I'm from Vancouver, Canada. Moved here 13 years ago and never really looked back. I wasn't retired. I'm still not retired. I keep reminding Oscar of that. But I actually just turned 60 here in Panama. But I moved down here as a working guy and opened up a business with Oscar. And him and I have been working together well before Megan, since 2014. And then when we started this company was at the time that Oscar and Megan met, and Megan was a perfect addition to keep Oscar and I from killing each other. So that worked really well. And we're great business partners. We each know our own thing very, very well. We just have to learn to keep them separate, and then we're good. But anyhow, so Megan told you what we do. We do it well. We're kind of sold out right now on tours. People keep begging for tours. I'm going to give a little hint. Watch your email, you people on the backup list, because Megan's confirming rooms, because the way it worked out right now, we might have one room available on the January 23rd tour, but that's only going to be for singles. So any of you single listening that are on that backup list, stop emailing me every day like some of you do. We don't mind, honestly. But yeah. So, and same as our Cherokee Highlands tour, they sold out too, but we do have that one spot in April, at the end of April, available. So that is who we are. That is our 3 minutes of promotion, Megan, that we're allowed to do here.
Perfect.
And now we're going to go into what we're going to talk about tonight, which is healthcare, folks. Now, big thing first of all, to your U.S. folks, Panama is not part of the USA. So your healthcare doesn't work. You don't have your basic Social Security here. You don't have anything like that. And in Canada, for you Canadians, Panama does not have free healthcare. So what do we have? We have a two-tiered system here. We have a public health system and a private health system. Now, many of the Panamanians are kind of in both. Many of them will use the public system, but for serious stuff, they carry some insurance, so they can use the private system. Because I don't want to bash the public system. There's some excellent doctors, some excellent people working in that system that really want to help you. But honestly, folks, you have you Canadians will relate to this: long wait time, a lack of doctors and nurses, a lack of medicines. They do have a 911 ambulance service, but after you phone it in Spanish, they still can't tell you if the ambulance is actually coming. I just went through this in July with a guest, and they were okay, by the way. Everything worked out well, but it's very inexpensive. A doctor's visit is literally 50 cents. A specialist might be $2 or $5. An X-ray, again, pocket change. You break a hand, it's going to be like $25 at the emergency room to get casted. And I don't know if they cast hands, but let's say an arm. So it's very, very inexpensive. My good friend in Panama City, he's retired. He's a gringo, but he came down here on a very, very tight Social Security budget and opted for no private health insurance. Well, he ended up getting a hernia that he left because he didn't have the money to get it fixed, and it ruptured. And for those of you who know anything about medical, that means if it's not treated, he dies. Well, his friends ended up driving him to the public hospital in Panama City, where he was virtually, bleeding to death on it. But so they took him right in, and they were able to do the surgery right away. And he had 3 days in the hospital. Now, he remembered after surgery waking up in what he called a dormitory. And literally, that's what it is, folks. There's no such thing as private rooms in the public healthcare system. They are dorms. They separate if they don't separate the hospitals, men and women, they separate the sections, men and women, because there's no privacy. There's nothing like that. But he was in a lot of pain, and he asked for pain meds, and they brought him ibuprofen. That's all the hospital had to give him. And he had major surgery, you guys. Like 3 days, and they had to get him out of there. You probably in a private system, he probably would have been in for a week, but the public system, nope, you're out of here after 3 days. You can walk. And he went to the front to get the bill. It was $165 with the option to pay it over 12 monthly installments. So yes, the healthcare is there. Did he luck out that just when he came in at that time, there was a doctor available to treat him and do the surgery? Probably, yeah. He lucked out. Allie can tell her story with her father that he didn't luck out. He needed something that the public system just couldn't do for him. So the public system is there. It's also basically free for employees paying into Social Security and for Panama retirees who are on Social Security. So I don't think free really matters when it's 50 cents to see a doctor. But that $165 surgery would have been free. I don't know if that's good or bad. But that is the public system, guys. So it is there, is available. You can get your flu shots every year with it. You line up for it. But Megan, you had a choice because you were here. You didn't have insurance yet because you and Oscar were having a child, and it didn't cover you for the first few years, whatever. Mm-hmm. You looked at the public system, didn't you? Like to give birth at once?
No. Well, I knew I just had heard so much about it. I knew that I didn't want to go there because you are birthing in dormitory type rooms and you're not allowed to bring anyone in with you.
Well, the women can all cheer each other on.
Yeah, and then you get moved to your private birthing room when you're actually about to have your child, but you're not allowed. No one is allowed in with you. So I knew that wasn't something that I wanted to do.
So you went. So to give birth, I'm sure it'd be very inexpensive.
So private system, if with your own private room, I think if it ends up being natural birth, it's around $3,000. Yeah. I ended up being C-section. I was in there for 2 or 3 days. I can't remember now. But I think it was around 5, maybe 6,000.
But in the public system, that would have been
free.
Yeah.
Yeah, birth is completely free in the public system.
Yeah. Mm-hmm. Okay. Now, private healthcare system. We have private hospitals, doctors, and labs all over the country. They're extremely efficient, short wait times. Great example, again, friend of mine, guest of ours. He went to see the local doctor here. He said, I hear something funny with your heart. You need to see a specialist. You know what that usually means. Okay, when am I going to see a specialist? Well, the doctor left. He came back. He goes, how's next Tuesday? This was on a Thursday. Really? Okay, I'm going to see the heart specialist on Tuesday. So he goes into David and sees the heart specialist. And the doctor said, yeah, you need a heart stent. How's next Monday for you? That's how efficient and fast the system is here for wait times. So doctors are available, nurses are available, and medicines are basically what they need is available. It's very similar to the North American system.
If not better.
Yeah.
More efficient.
More efficient. The doctors give you their cell phone numbers, like the surgeons. Now, it is way more reasonably priced because obviously I don't think you can give birth in, it's not many retirees giving birth here, but it's not, thank goodness. Megan, what is, I don't know what the number is.
It varies greatly.
25,000 is what I'm hearing people usually say, 25
on
to 40,000.
average. Yeah.
Yeah. And here you're looking at 2,500. But the surgeries, my friend's heart stent was 7,000. I know a guy who had a hip replacement recently for 9,000 in the private system. And what was I can't remember the other one. It was just a typical surgery in there for 3 days. And it was nope, I can't remember. It's not coming to. It's very affordable. I had someone quote me what their cancer surgery was, which was the full treatment, the surgery, the chemos, everything in the private system, anywhere they wanted, like the best care ever, and it was like $50,000 for a 2.5 year treatment. But you don't like who wants to spend $50,000 on your health care? You need some type of health insurance. Now, health insurance here works different than it does in the US. Here, it is more like the international insurance, which most expats get because they're still traveling or they're still going home or they want to do some more travel. It works basically on a deductible type system. There are no copays in it. So unlike you guys in the US that are used to deductible and copay, this is a deductible. I'll give you an example. I don't know why. I got something caught in my throat. I apologize for that, folks. So I have a plan that covers me for $1 million a year internationally. I have a $1,000 deductible here in Panama, and that's for things like, doctor's visits, prescriptions, stuff like that. If it's an emergency, there's no deductible. I don't have any copay. So if I, fall off my bike and get rushed to a hospital and they fix my broken legs and arms and whatever, the only thing that comes out of my wallet is my insurance card. So there's no charge for anything. So it's kind of nice comfort having that type of insurance. When I travel outside of, I should say, my covers me throughout Central America and Colombia. If I travel outside of those areas, I have a $10,000 deductible. Some people find that steep, but when I do travel outside those areas, I just buy some gap insurance for the few weeks that I'm gone. And mine costs $60 a week, and it covers up to $10,000. So basically, I just make sure I got enough money on the card. So if I did go to the States or Canada and something happened, they would charge $10,000 to my card, and I have a type of company like the plan. I'll tell you in a second. Is well known around the world, so most hospitals will take it, and so they'll charge my card the deductible and bill the company the rest, and then I claim the insurance for my card, so I'm still out of pocket nothing. So I pay $250. It's $248.52. I can never remember. $250 a month for that plan at 60 years old. So, I'm quite happy with it. The company is MAPFRE, MAPFRE. Ellie will talk a bit about them. So that is, and it's just if I can use my options here are, if I want to go see a doctor, I can see Dr. Gomez in town. He's $15. Why would I go anywhere else? And I'm never right now, I'm not taking any medication, so I'm not worried about my deductible, so I just pay it and forget about it. But if I was taking expensive monthly prescriptions and going to see the doctor and test, I keep them, and once I reach 1,000, I can start claiming all those things. Mm-hmm. So that is the difference between the healthcare and private healthcare and public. Now we are going to bring Allie on. I always like to give notice in case, me, I'll be fixing my hair, but Allie always looks great. So she's fixing her hair now. Megan, let's introduce Allie.
Welcome, Ali. How are you?
Hi guys. Thank you for having me here again.
Thanks for
Very
coming
good.
on. Yeah, the last call, which we did earlier this year, was so successful. So we wanted her to come on again and take some more questions and have a new audience hear all of the knowledge you have to share. So can you share a little bit about who you are, the company you work for, and what type of services you offer?
Yes, sure. So yeah, as you all know, and you can see right here, my name is Ale Bretel. I work with Grupo Central de Seguros. I'm a local Bogotanian. I'm almost neighbors with Megan, so we all live here in town. I grew up here and I went to study abroad and came back, and I'm raising my family here. And I work with this company called Grupo Central de Seguros. That is a huge brokerage company. We have a big offices in Panama City, right across the street from Multiplaza. If any of you have come, or when you come, for sure you're gonna see where Multiplaza is. It's like in the middle of the city. And we have that like a huge back office with all departments. We manage all type of insurance: health insurance, car insurance, home insurance, personal risks, travel insurance, like everything. And we have a huge office that can take care of anything of the problems that you might have with reimbursement, with payments, with all of that. Also, of course, if you do it through us, I'm always available. I'm always there with any questions that you might have. But it so you know that it's not only me. Like we have it, and if in the end you decide not to come to Boquete or go to Panama City or some other place, we have people that can assist you everywhere you are in Panama.
Yeah, I think that's a huge part about going through a broker here is that you want somebody who knows the local system, knows the local doctors, can give you referrals, can translate for you between your insurance company, which is why we always recommend that you buy directly with a Panamanian broker who can, if God forbid you have to use your insurance, they can really guide you.
Yeah. And whatever, like the myth online, do not believe it, folks. If you buy from a broker, you're going to pay more than if you buy directly with the company. That is an outright lie, and you can prove it to whoever told you that by get quotes from Allie, and she's going to tell you the names of the companies. She's not going to hide them. And then you're going to go to the company website and get a quote from them. Guess what? They'll be the same. I've done that. I've had many people come, oh, I've been told that they'll charge 30 or 40% more. Some unscrupulous agents way in the past tried that. And maybe they got away with it, maybe they didn't. But no, they like Ellie gets paid, like their company gets a commission from the insurance company that doesn't come from us. The insurance, if you buy directly from the insurance company makes more. And like Megan said, you want an Ellie on your side if you don't speak Spanish well and you have an issue or you're trying to get an operation approved and you just can't get through to the right person. Your broker is the one that's there. It's your broker that wants you to renew next year, so they're going to help you.
Yeah.
And it's just so nice to have somebody like Ale break down all the different options. Like what are the costs? What do they include? International versus Panama versus Central America coverage. And what does each different tier of premium get you as far as coverage? So I think Rod kind of got into the public and private health system a lot. But I think a lot of people are surprised to hear that actually most Panamanians that can afford it will opt for private healthcare. So can you maybe just talk a little bit about that, your experience with the healthcare system here?
Yeah, I mean, I have a very close to my heart and personal experience with healthcare. My dad is a doctor. He's retired now, of course, but he used to be town doctor here in Boquete for many, many years. He worked, he had his private clinic, and he as well he worked with the public health system, as many doctors do here, right? They have like their private practice and they work as well in the public health system. So of course he knew like all the medical industry, like he had a lot of contacts everywhere. And one day when he was strong and healthy, he said like, you know what, I'm just gonna cancel my private healthcare because I don't need it. Like I'm healthy, I'm good. I'm a doctor. I know everyone here. Like in case I need anything, I can just contact whatever my doctor friends and they can help me out, right? But when he was already retired during 2020 in September to be exact, he didn't feel good. He had like a thing in the heart and he had to go into emergency. And of course, in the public health system at that moment, what they needed to do was to put in 3 stems, and they didn't have the equipment to do it at that precise moment. And he had to go into private healthcare and pay it out of pocket and in a hospital. And he paid $30,000. And honestly, I think he got a discount because it can be more expensive than that. Probably, yes, he had a friend that attended him and he's like, hey, you know what? We're not going to charge you that much, but $30,000. Like, who wants to pay that? And thankfully he had the money and he could pay it. But I mean, you don't wake up one day saying like, I'm gonna spend $30,000, right? This was completely unexpected, and he had all the contacts. He knew a bunch of doctors. He actually had a personal friend relationship with the director of the public health system nationwide here in Panama, and it was nothing that he could do. Like it's not a thing that day it didn't work. The system doesn't work. And as Ron mentioned earlier, I agree. And of course, like there are many qualified and good doctors in the public health system. We are not here to bash them or anything like that. It's just like it's a bigger problem of the system itself that doesn't work, and that is not what we want when we're thinking in our healthcare, right? Like we know that if we don't have health, we don't have nothing. So like that is the thing in which we want to spend the most and have the ultimate care that we need, right? So
Yeah, because I think most doctors actually split their time between private and public. It's just more of like sometimes they don't have the equipment or materials necessary to treat certain people, or they're
exactly.
understaffed or something like that.
Exactly. Yeah, no, actually, for you to graduate like as an official doctor and go to do your own private, I think this is like what they do in every country. Like you need to work first with the public health system. And many of them keep on working with the public health system their whole career. And they're very good doctors, but yeah, they don't have what they need to do what they have to do.
Mhm.
Yeah.
So talk a
So
little bit about the procedure of getting an international health plan or a local, like what's required,
yeah.
what stage of your residency can you start, stuff like that.
Okay, yeah, that is important. So as soon as you are starting your residency, like you called out on your lawyer and said, "Hey, I want to get this paperwork starting. Let's do it." At the same moment, you can do your health insurance. You do not need to have your final paperwork to wait and then go do your health insurance. The only thing that they want to know is that you for sure are going to be a resident here in Panama. So as long as you are already like start getting the process started, you can get the process started for your healthcare insurance. So you have two options regarding healthcare. You have local health insurance and you have international health insurance. For your local health insurance, they both have an entry eligibility age. So for your local health insurance, the entry eligibility age is 65 years old. So if you are 66, you cannot apply to a local health insurance. But you can apply to an international health insurance because the entry eligibility for the international health insurance is 75. So you have that, those are like the two big requirements that you need to either apply to one or the other, right? um this means only the entry eligibility. It's not like, let's say if you are 60 and you want to go into local health insurance and 5 years later you turn 65, oh Ale, I'm gonna get kicked out of my insurance. No, once you're in, you're in, and as long as you keep on paying until you're 120, you will be insured. No problem. This is only for your entry eligibility. Same with international. This is your entry eligibility. So probably some of you are asking, like, okay, what happens if I'm older than 75? Okay, if you're older than 75, we have one option that is called Family Care Plan from PALIC, Pan American Life Insurance. This is the name of the company, and the name of the plan is Family Care Plan. I believe, I'm not sure if Rod has it on their website, but for sure he has it on your brochure
Yeah.
when you come down on the tour with them. And this is a more basic coverage, but is something good to have. Like it would cover your like emergencies, doctor visits, etc. It's, let's compare it with what Ron mentioned about his coverage of international coverage, like $1 million per year. This is going to be $50,000 per year, and it works with a copay. I'm gonna go into that a little bit for later, but I want to talk about this insurance specifically. And they have some waiting periods for some things. For example, for your medication coverage, they pay it at a 50%, but you have to they have a waiting period of 6 months. This means you have to be accepted, wait 6 months, and then you get the coverage. Okay. The good part of this insurance is that it's not as expensive. So, for example, average pricing for a person that is 65 to 67 could be around 120 dollars per month. So compared with international insurance, it's pretty affordable.
It's a lower premium, but you would pay more at the time of using it.
Yeah,
Correct.
because you pay a 30%.
Right.
Correct.
It's
Yeah.
still a good program for those over 75 that don't have any other options here.
Yeah.
So at least they have some insurance. Mhm.
Yeah. Another important thing, like a big difference about local insurance and international insurance, is that local insurance is, of course, for Panama, right? It's only for you to get coverage while you're in Panama. International insurance is for Panama and everywhere in the world. Like if you go back to the United States, if you're on a vacation trip in Europe, if you want to go to Mexico, like whatever you are, this insurance will cover you. If you want to have like a procedure done, for example, I'm gonna be specific on one specific insurance company that is called Worldwide Medical. They have like a special alliance with hospitals in Spain. And if you need a hip replacement and you don't want it done in Panama for whatever reason that is, and you want to do it in Spain, they have like a package that they include you flight tickets up to $1,500, stays in hotels, and the whole procedure over there with top of the line uh, doctors in Spain. And you can do that with other countries as well. This is a specific plan that they also include the stay, and like typically they do not include stay and flights. This is like a specific thing for worldwide on Spain. But if you want to do a treatment back home, in the United States because your family is there and they can take care of you or whatever reason it might be, you can do that. Okay. Um, Another thing is another big difference on this two insurances, local and international, is locals insurance typically work with copays and international insurance work with deductibles. So copays are like, for example, if you they have like a list of providers on whom this specific insurance companies work with. So let's say you need to go to the cardiologist and you go to one that are on the list of providers of insurance companies. Don't worry, most insurance companies work with all of the doctors and all of the hospitals, private hospitals here in Panama. So you don't have to worry about that. And you go to one of that list. If you go to one of the doctors from that list, you will get a copay of, I don't know, if that doctor typically charges $80 per consultation, you are going to have at 25 or at 20, depending on the agreement that the insurance company has. And that's your benefit with that insurance company. If you decide like, hey, like none of these cardiologists on the list like work for me, I want to go with a different one that is not part of the list, it's fine. You can do it, but you pay it out of pocket and then you fill out a reimbursement form, and the insurance companies reimburse you, not at 100%, but a part of it. Okay. So that's how copays work. The same for hospitalization. They have like different copays depending on the hospital that you decide on and stuff like that. And then the international insurance works with the deductible. The deductible, probably you're a little bit more familiarized with that term, is that you have a certain deductible. You decide it could be a lower one or it could be a high one. The higher the deductible, the lower the premium you're going to pay. And let's say medication, um, consultations with doctors, and labs all have to go towards your deductible. And once you reach that deductible, then the insurance company starts paying 100% of whatever you get done. That deductible is renewable annually. It could be annually January to December, or it could be annually the term of your insurance whenever you started it, and it's going to renew when it starts again.
Okay. So should we just dive into questions? So what do you think?
Yeah, let's dive into questions.
Okay. All right. First question from Brad and Margaret. Are there any international health plans for those over 75?
Great question. There are not. You can get travel insurance on that case. Like when you know you're going to travel somewhere, you get a travel insurance for that specific travel, or you can get even like a yearly travel insurance. If you're a person that travels a lot, you just get a yearly travel insurance, and that is the one that you use when you are international.
Perfect. Okay, Harvey asks if pre-existing conditions have been taken care of by surgery and other managed with medications. Yeah, kind of get into the pre-existing conditions, because for you U.S. folks, no international health insurance companies anywhere outside of the U.S. exclusively cover all pre-existing conditions. That's an Affordable Care Act thing. It has nothing to do with the rest of the world. So if you can get into a bit, Ellie, about pre-existing conditions and how they're handled and which ones might be accepted, which ones absolutely won't,
I mean, this one is a difficult topic because it's definitely going to depend on specific cases. Like I cannot tell you like on average, like, oh, like typically this condition is not accepted and this other isn't. It's going to depend on how many pre-existing conditions you have and how is your health at the moment, because for sure they're going to ask for labs get done. so they can evaluate like, okay, this person is a healthy person or not really. So it is managed very different depending on the case. And I can lay out like the different scenarios that we have for sure. We have had a scenario on where the insurance company says like, okay, listen, you have diabetes, so given this situation, we're not going to cover you diabetes for the next 2 years. We are going to accept you into the insurance. And in 2 years, we're going to go over it again and see if we change that or if it remains as is. That is one case. Another case has been like, okay, you have diabetes, it's under control, you haven't had any problem with it, or high blood pressure, whatever. Um, but we are going to cover it, but we are going to have an overcharge on the initial premium that we quoted for you of 20 or 30%, because we're not sure if something can happen and you could be at risk. So we're going to have an overcharge. And sometimes they can even say also, like, we are going to reevaluate that overcharge in the past specific time, I don't know, 6 months, a year, and see if it needs to be considered, or if we can let it pass and charge you like regularly what we had quoted initially. That is another scenario. We of course have had the scenario of people getting denied. It happens. Um, but I mean, I think we already have a couple of cases that I could bring to the table, that they have been denied in one insurance, they have been denied on a second insurance, and we end up finding an option for them that works and that gives them coverage. Like, I'm not going to stop until I find something. Sometimes it's really difficult, and I cannot tell you like 100% of the time it's you're always going to get coverage, but for sure I'm going to do my best for you to get the best option that you need with whatever condition it is that you have.
Perfect. Okay, Vicky asked, if I want less than $1 million medical coverage, where can I find options? I am 70 years old, my husband's 77.
Yeah, so the family care plan that I mentioned could probably be an option for you. That is a $50,000 coverage. It would definitely be the option for your husband since he's 77. So that is the option that we have available for people over 75.
Perfect. Kevin and Mary, good question. Just went through this. With the pensionado visa, is there a discount in glasses and hearing aids? With the pensionado visa, there's a discount on your consult from doctor's consults. So I just went through this with my eye test. So the doctor charged me like $30 for my consult. Yes, there's a discount on that. There's no discount on hardware though, like the actual physical glass or hearing aids. And same as the hospital. If you go into a hospital, correct me if I'm wrong, Ali, but if you go into the hospital, you can get pensionado discount on all the services, but possibly not the actual hip that they had to buy. Like
Correct.
you have to get it on the like the doctor, the surgeon fee, on all the services.
Exactly. Yep.
Yeah. Okay. It's a good question, Cynthia. We get this all the time. Allie, does anyone here in Panama sell travel insurance for specifically Panama? Like someone who's not a resident here, but they want to be insured here?
Actually, I just had a meeting today with a company offering a product like that. I still have to go more into detail about it. So I don't want to like give you that much information because I don't have like all the details on it. We're gonna dive into it next week. And as soon as I have it, I'm gonna share it with you guys. So maybe you can like include it in your information for your clients to have.
Yeah, they should. Yeah, like, I was a Canadian. When we went to Mexico, we could buy insurance in Mexico as we vacation there for a month or two.
Yeah.
Okay. Alrighty, we will find more on that for you, Cynthia. Okay, let's talk about the annual cost of living and age bracket increases in insurance, Ellen.
Yeah, yes, it does. So insurance companies, what they do is they take a risk, right, for whatever it is that they are insuring, and our health, that the risk changes every now and then as we get older. So yeah, they have an age bracket of every 5 years, um, increasing the pricing on the premium. Typically is like from 20 to 25, from 25 to 30, from 30 to 35. So if you take your insurance company today and you are 59 and you tomorrow turn 60, most likely you're going to get an increase. So it doesn't depend on when you take it, but on those every 5 years.
And usually that's capped at 70 or 75 whenever is the cutoff age.
No.
So it'll keep going up until 90, 95.
Yeah.
Okay.
Yeah. It keeps on, and at those ages probably even more, because you you are more risk.
Mm-hmm.
I'm in my 90s. I'm never going to use it. Okay. Uh, being here, Ellie, for all your, 25 years that you've lived in Panama, with your family and medical. Let's talk about elder care in Panama from a Panamanian point of view and what you've seen with the expat communities growing older here and what your comments on that.
Listen, again, this is very close to my heart at the moment. um Elder care, I mean, it's definitely very different than in Panama. I'm saying that this is close to my heart because we had to do this with my dad. My dad has a frontal lobe dementia, and we have had to look for care for him. And elder care in Panama, specifically in Panama City, where he is located, for someone to come into your home and be with you 24 hours, and they have like a little bit of knowledge of nursery and this type of things, the cost could be around 2,000, $2,200 more or less per month, right? And you have a person with you 24/7. They live in with you, right? uh but for like having a home or a residence or a place to take someone, obviously in Panama City is where you have like the more amount of options. Here in Boquete, I believe there's one or two, maybe, and probably in David also. Honestly, in the other provinces in Panama, I do not know because we did not needed to do that research. But in Panama City, there are a lot of options, and there are very premium ones, very mid ones, and very low ones, right? So an example for one in Panama City that is like really good, and it's well located, and it's a house and it has like big spaces. They have a lot of personal caregivers attending the people there. For a shared bedroom is $1,500 a month, and they include all of their foods. You of course have to take the medicines for that you are going to consume or whatever, right? You have to pay for that outside. But they take care of everything. Like if you need help with taking a bath, or like you are most of the time in bed, they take care of that. If you're a person that is active and that still like do activities and everything, they have a person that is there like taking care of that, taking you for a walk. They have like dance classes and art classes and this type of stuff. The very high end premium places For a private room, it's around $5,000, more or less, monthly. And of course, they include all foods and everything. So those are more or less the pricings and options that you have here.
Of course, Panama City is the most expensive place in the country.
It
We'll
is.
get home care right now. That's the one decent place we have here in Boquete. It is $1,200 a month, so it's a little cheaper than Panama City, and it's the same company in David also. So there is that, but guys, there's a lot of business people in this country, and as the expat population gets older, especially the single ones, because it typically happens that either they're single when they come here or one of the couple passes away, they're going to need that type of care. So trust me, someone's going to build it, and to make room for it. So
yeah,
you will have it. Okay, next question is international health coverage reimbursement only? No. It's most hospitals take the insurance, bill the insurance company, correct?
Yeah. Of course, this is for emergencies. They cover it at 100%. You do not have to go through the deductible.
Yeah.
The deductible works more for like medical consultations, prescription medications, labs, those type of things, or like an outpatient surgery. That depending on the insurance companies, some of them do cover it at 100% without deductible. Some of them you need to go through the deductible. It depends.
But the only time, like as far as reimbursement goes, Allie, I think she's thinking that let's say you'd have to pay the whole $10,000 bill and submit your claim. That might happen if you're traveling internationally outside of a network hospital.
No. If it's an accident, no.
No, if you're traveling internationally outside of a network hospital, you might have to pay the bill and get reimbursed later.
Yeah, but what I'm meaning is like if the reason why you went in is an emergency, you don't have to pay anything.
No, but what happens if I am in Portugal in some small town in their hospital, and I end up in the hospital? I'm going to have to pay the bill because they're not.
Most likely, typically, you like the scenario is that you go through emergency.
Yeah.
So if you go through the emergency room, you don't have to pay anything.
Okay. Mm-hmm.
Oh, you mean like probably if it's not like in the list of providers that
if it's not a network hospital is what I'm talking about.
Yeah, it depends on the insurance, because there are insurance companies that they don't have a list of providers and they work with all and any hospital there is.
So you got a card and they got a number to phone and the hospital will phone and
yeah.
So most international insurance is going to be you show your card and that's what you pay. That's it. Nothing. That's the best. Okay. Question. Megan, you read the question.
Sharon, I'm a federal retiree. I have Blue Cross Blue Shield. Do Panama accept my insurance?
I'm not sure how that. We have Blue Cross Blue Shield here in Panama as well.
Mm-hmm.
This is an international brand, and they work here in Panama through Internacional de Seguros. That is a company here in Panama. Honestly, I'm not sure if you could like do like a passover, like, hey, I'm gonna be in Panama now, so pass it on to the representative in Panama. That is a good question that I can ask. Or if you have to do a whole new process.
Yeah, Sharon, you can reach out to us and we can connect you directly with Ale, and she can find out about that for you.
Yeah.
If it can be a direct transfer or how that works exactly.
Yeah.
Okay, here's a good question from Debbie. How are you? Let's bring this into the thing, okay?
Perfect. Yes, we were going to talk about this. I was told that there's a service like 911 called Ron's. Close. Have you heard of it? Is it good? Yes, it's called Rodney Direct.
Rondi? No. People, my grandma used to call me Rondi all the time, so that's fine.
but this isn't you.
No, this is not me.
Yes, Rodney Direct is started in Boquete, but now is countrywide. And it's a hotline. So if you have an emergency, you sign up to be a part of his program, which is, I think, less than $100 a year.
It's $80 a year.
Yeah, and it's basically he has a profile on you to know everything he would need to know in case of an emergency, and you can call him and he will connect you with the local emergency services.
Yeah, it's everything. They have your GPS coordinates just in case. All you can say, like I have it in my speed dial 11 or AAA Rodney. I just dial it and they recognize my number, so they know who's calling. And if I say help, that's all I gotta say. They know where I live. Not only do they know where I live, they know I have dogs. They know to call Oscar and Megan to come look after the dogs. They know who my landlord is. They know everything in my profile, and they will look after everything for me. They know my family doctor. They know my insurance company. They got Allie's number, everything. So it's a great service. You can even phone them for if the lightning hit your power pole, or if there's an accident on the street, or if you were out and you witnessed something else. We were with a group and we had an incident where a client thought he had the flu, but his blood oxygen dropped below 80, and I needed an ambulance to get him to the hospital. So the hotel was trying to phone the public ambulance, and they said, "We got through." I go, "When are they coming?" They don't know. I phoned Rodney and I said, "Rodney, can you get an ambulance over to this hotel?" He goes, he phones me back in 5 minutes. "It'll be there in 5 minutes." Okay, thank you. Okay. And it's English, because 911, when you phone 911 here, you can phone 911, but they don't say press 2 for English. No, there's no such thing like that. So if you don't speak fluent Spanish and are not able to explain to them where you live, because there are no house numbers and street names and street signs here, 911 is not really an option for you. So what is the other one called in Coronado? Rodney works with them, so he will connect you.
Panama Health Line. Yeah,
Panama Health Line. There's one in Coronado too, but Rodney will just go, like I have it up on the screen. Just look at the way Rodney is spelled and write that down. It's rodneydirect.com. So in the note section, say Retire in Panama sent you. We love Rodney. He's a good guy.
Yeah, we've had him on before.
Yes. It's just that we knew this Q&A was a little shorter this time, and so Rodney didn't get to come on. I know. I hope he's not watching. Because we're always going to be mad. Okay. Oh.
Yeah, we always got to plug that. That's an important one. People forget about what do I do in case of an emergency.
Yeah, it's so important. And especially a full service thing like that all you know, like what would I do if I just phoned 911 myself and the ambulance picked me up and took me away and I'm not conscious? What about my poor girls?
Yeah.
Yeah. Okay. Anyways, I was recently in Panama. Had to take my son to the emergency room at Patilla twice. Patilla. The first day I paid $608, and second day I paid $2,000. Okay. I'm not sure if that's a question or. But hospital Patilla. Is there a hospital Patilla, or is that
private?
Is that food?
In Panama.
Private hospital.
Panama City,
yeah. That doesn't give us much context though for
no.
what exactly they were paying for.
But I mean, just like to make a comment on that, like if he had a private health insurance, that would probably have been like $75 or tops.
On the plan, the copay plan that Ellie was telling you about, we have a client who was told he can't get insurance because he's over 75. Well, Ellie got him insurance on that one, and he used it, Ellie, last weekend. It's nothing serious. He's okay. A client of ours that he used his Cherokee Hospital plan in Cherokee Hospital in the emergency room. He was there 3 hours. He got seen. He got to the concierge immediately after checking in. The doctor within 5 minutes. He was in a room. They had him on IVs and fluids and then painkillers and then the antibiotics. 3.5 hours in. The whole bill was $330. His share was $110.
Yeah, and I want to share also a little bit about that because like the after like you get your health insurance with us and it's like okay bye I forget. No, like he immediately like next Monday he was writing to me sending me all the paperwork like hey look I was in the hospital like this were my expenses, this is my reimbursement for form, send it over and we are trying to look if he like he needs to get paid for that or what the process is like I keep on communication with you guys like
Yeah.
after it or even when you are in the emergency room like hey I'm here like what do I have to do whatever I can assist you with that. I mean I always tell them like if it's in the middle of the night I'm probably not going to answer but you have all the numbers that you have to reach out that are gonna assist you immediately.
Yeah, she's going to advocate you and let you know, hey, you shouldn't be paying for this or that, things that you probably don't know, and make sure that the bill is what it should be.
Yeah.
Okay. Next question is
Terry, I've gotten conflicting info on time and country requirements for worldwide medical. How many months are you allowed to be outside of Panama?
Hi,
okay. Well,
Terry.
this shouldn't.
I
think
think I
this
know
is
you.
pretty straightforward, Allie.
Yeah, I think
Mhm.
we have. If this is the same theory, I think it is. We have been talking on and off. Yeah. So most insurance companies have like from 3 to 6 months that you can be continuously out. I believe for worldwide medical, I don't have it at the top of mind right now, but I think it is 3 months continuously or not continuously as well because as I mentioned at the beginning like they want to make sure that this place is where you're living right like 100% of the time so they don't want you to be like oh I have an insurance in Panama but I'm actually living in United States or whatever other place it might be.
Yeah, I think generally you're supposed to be in Panama at least 6 months of the year. And then in the US, at least, you can't be there for more than 3 months consecutively because medical care is really expensive in the US. And of course, the
Yeah.
Panama premium is going to be a lot less because they expect you to get treated mostly here.
I've seen someone who has a one of our clients has a worldwide policy, and we looked it up a couple weeks ago. 3 countries you can only be in 90 days consecutively, and that's the U.S., Canada, and Brazil. Do I have that right, Allie?
Yeah.
Yeah. So
Mhm.
90 days. That's it. Okay. Now we're going to talk. Okay, I'm trying to group some questions as we get because we're just going to end it here pretty quickly. Medicare, TRICARE, and VA. Let's talk TRICARE for life and VA. Yes, there are hospitals in Panama City that will bill TRICARE directly. There are some in David. There's some doctor services here in Boquete, and we're going to have on the VA guys in January. Here, we only have 2 more Q&As this year, and with a doctor that assists with that up here in Boquete, and we're going to get you all that information soon. But yes, I know many people with TRICARE and or TRICARE for life that have had their procedures done here and billed directly through TRICARE. Okay. Okay, now let's move on to this big one, Big Mom here. We're gonna I'm gonna put Allie. I almost forgot to do this. Jeez. I want you all to take a picture of the screen right now. I'll get rid of this question once I read it, and of Allie's information, so you can contact her to get full quote for yourself. Now, Jean, I said some folks are advising Medicare full coverage, so you can return to the U.S. for non-emergency. Does that make sense? Or international health insurance here that covers U.S. medical when you're back there. Does that make a better idea? Well, Jean, let me tell you, if you try, an Advantage plan, which is full, what you're talking about, full Medicare, I assume, some type of an Advantage plan, is great for people that are part time in Panama. Let's say you're 5 months here and 7 months at home. It's an excellent plan. You have to pay out of pocket. They're trying to get some hospitals to work to start paying for it. We know there's some test programs going on in David yet. There's nothing official. But right now, because Medicare Advantage plans cover you for emergency care outside of the U.S.
For U.S. residents.
Yes, I'm talking U.S. citizens only, and for U.S. residents. If you're a resident of the U.S., meaning you have a home, because every October, November during the healthcare.gov months, you have to claim I live at this zip code, and then you pick your Advantage plan, and that covers you to travel internationally. Some have restrictions, so you got to check your plan. Some says you can be out 3 months or 90 days. Some say 6 months or 180 days. Now, what it covers you for is emergency only. So let's say you have a heart attack. They take you to the hospital. They're able to, recover you. Things look good. The doctor looks, you need a valve job. You're going to have to get that done in the next month or two. You're not covered for that. You're going to have to go home to get that done. They will cover you for that emergency hospital stay that you went in because you had that heart attack, but they're not going to cover you for the surgery because the doctor said it's 2 months down the road. It wasn't an emergency surgery.
At least not in Panama.
Yeah. So, or if you get hit by a car, they'll cover you to fix it. But let's say they're doing a knee replacement and your other knee has to be done. Like their job is to fix you up that you can go home, because your home country, you're still claiming as the U.S. if you're on an Advantage plan. It will not cover you for things like cancers or other serious illnesses that you've been diagnosed with, because they expect you're traveling. You need to go home to see your family doctor back in the States in the zip code that you're signing your honest name to. I live here. So what's better? If you're going to pay $170 a month, add another $170 to that, $340. If you're in your mid-60s, that will basically pay for an international plan that has no copay whatsoever. Just a deductible. And that deductible, like especially here, like I've told you, mine's $1,000. So you can, and if I travel, I buy insurance. So that can literally become your supplement back in the USA. You can use your Medicare A to get into the hospital and to get into your emergency room, but your insurance plan, and to cover most of that stuff that your deductible would have, but your international insurance plan becomes your supplement. But that means you would have to cancel your Medicare Advantage, but you want to be careful. You want to make sure, I love Panama. I'm living here forever. I bought my plot, my burial plot. I have my casket picked out, everything. I'm getting buried here. I'm going to live here. And if you're that much in love with Panama, then you can cancel your, Plan B, Advantage plan, and stuff like that.
You can always opt back in. You'll pay a penalty, but
you'll pay a 10% per year penalty.
But this is a big topic right now, so we always like to make those two things clear. It really depends on your situation. Are you a real permanent resident here, living here full time, or are you part time?
Let me tell you a $40,000 story, guys. And when I throw that number in front of there, that usually makes people listen up. So, a lady here, I'm not going to mention names. They're gone, but some of you in Boquete probably knew them. Her husband had a major heart attack, and he had to have a quadruple bypass from emergency room to the surgery. They had no insurance. They had been told by everyone, I can use my Advantage plan. That's not a problem. The husband did all the paperwork and handled everything. The wife knew nothing. In an audit by the healthcare.gov, the lady was they had to pay for out of pocket. It was $40,000, and then the lady was submitting all the bills. The husband survived, which is great, and the lady was submitting the bills to her insurance company. She got a call from a government auditor, and was talking to her and being really nice. And the auditor said, "So, how long have you been in Panama?" And the lady said, "Oh, we moved down here 7 years ago, sold everything back in the States." And well, apparently her husband had been signing these healthcare forms every year saying that he actually lived in the States, and they were denied the claim. It was their life savings. Mm-hmm. So it's not, I'm not going to tell you here. We can't tell you it's all, oh, just get an Advantage plan. Life is all rosy and wonderful. No, it's not, folks. Things happen. Government doesn't want you to live out of the country, and they still subsidize your health care. The U.S. government subsidizes your Advantage Health Insurance plan $200 to $500 per month, because it doesn't cost $170 a month for insurance, folks. Get real. The U.S. government is paying for that. So the U.S. government rule is you must live in the U.S. to be part of that Social Security Advantage plan. It's the insurance companies that want you to live in Panama because it costs 1/4 of the cost. And they don't mind at all if you live here full time and you lie in your forms every year that you live in the States. They don't mind at all because their claims are going to be a fraction of the cost of what they would be in the U.S. So that
For
is
us,
my
it's
answer.
all about making an informed decision, knowing the truth of the two options and making the best decision for yourself.
Yeah, it just doesn't make sense to me, because if you're diagnosed with something and you sold all your stuff in the States,
right?
Maybe you don't have kids.
Where do you go?
Yeah, what are you going to do? Like, you're going to have to go back for cancer treatment for 1.5 years because you can't. You're not going to cover it here. Okay. Alrighty, we are ending here. U.S. long-term policies will not cover nursing home centers. Well, they'll cover nursing homes. You're absolutely right, Bill. If you have an insurance policy in the U.S. for long-term care, it's only in the U.S. They really should bill like crazy, eh? Like $1,200 to $1,500 we're talking. Back in 2010, my dad was $5,500.
Wow.
When does insurance? A quick question. When does insurance cover? Oh, yeah. When does the insurance coverage happen after you sign the policy? Immediately or after some period? I guess it depends. Accidental care is immediately.
Well, for health insurance, it depends on the coverage. For car insurance, for example, it's immediately. For health insurance specifically, it does take a while. It could be anywhere from 2 weeks to a month to do the whole process. It depends on your case. If you need to do lab tests done, if you have a pre-existing condition or not. Definitely health care insurance is the one that takes the longest to get approved.
Do that. So what happens if I bought insurance from you and you say, Rod, you're accepted, you're good to go, you paid your first month, and then tomorrow I got diagnosed with a disease?
It also is going to depend on what coverage you get. But for example, with your coverage, Rod, that is an international plan for Mafre, and you get the next day, you get, I don't know, cancer or whatever, God forbid, you get coverage right away with that type of plan. With the only one that it could have like a waiting period for any like specific situation can be with the plan that is for people over 75, the family care plan from Pali.
Yeah.
That one has some waiting periods depending on what it is that you're getting treated. But with most of them, and you should have coverage right away for whatever it is, unless they announce that you have a waiting period for a specific thing. And for the one thing that they do for sure, all insurance companies have waiting periods. I don't know if it's the case for anyone here, but I'm going to mention it, is pregnancy. So pregnancy, the maternity coverage do have a waiting period of 12 to 13 months.
What? Oh, sorry. I guess that doesn't matter to me. Hey, Sharon, I don't know if you realize, but Ali is in Boquete. So if you guys each drive 15 minutes, you can meet in Dolega for coffee. So don't you worry about that. Does everyone take a picture of that screen? Do you have Allie's name? If you don't, you can hit the contact us button. We can do a personal introduction to you. So, yes, Allie can handle your insurance all over the country. Like she said, she works for a huge company. If you need a personal assistant where you need to come see somebody, she'll get someone in your area that can help you out. But the process is done through email and phone and stuff like that.
And she also does car, homeowners,
Oh yeah,
contents
car,
insurance,
homeowners,
all that
contents,
stuff
all
too.
that stuff. We can't get much into that, but we have gone way over time. I extended this one so we wouldn't get the notices that we're going over time.
Wait, wasn't it 3 to 4 hours?
Yeah. No, we do these every single week. So we do 1 hour. Next week, what are we doing next week?
I don't remember.
Oh my God, I can't
keep track.
remember. So we have Q&As every week at this time, guy. Next week is we're doing a Meet the Expats. We're going to meet some expats.
Nice.
Have you picked them yet? I think you did.
No, tell us who you want to hear from. What places? We'll find them.
Right.
Thanks for joining us, Ale.
Thank
So
you,
much
Ale.
good info.
Thank you for having me, guys. It was such a pleasure, and I'm excited to meet everyone that is coming next year.
All right.
Yeah, us
We
too.
have a lot of people coming.
Thanks
So
for all
thank
of
you
your
guys.
questions.
I think we got through all the questions, guys. Appreciate you guys being here.
And we'll catch you guys next time.
Hey, Melanie, how are you? All right, guys.
Good night,
Have a good
everyone.
night.
Good night. Bye-bye.